Welcome to the culture. We rest at the pulse of the community, providing all things news, music, fashion, events, and everything that we talk about in between. It's a lifestyle. We are the culture. Hi, and welcome to another edition of The Culture. I'm your host, Jessica Garrett Modkins, and it's Women's History Month. We've been tackling many issues tailored directly to women here on The Culture, and today it's all about our skin. Joining us is Dr. Yolanda Holmes. She's a board-certified dermatologist and surgeon, both in medical and cosmetic medicine. She's been featured in many publications such as Essence Magazine. She's also a faculty member at Howard University and George Washington University. Welcome to the show, Dr. Holmes.
Hi, good afternoon. Thank you for having me today.
Absolutely, it is our pleasure. We are excited to dig into all things concerning our skin. And as you know, we are in the midst of a coronavirus pandemic, and many have no idea that there are chronic symptoms that actually show up on our Black skin, and as well as other ailments. Let's look at a few of those examples, and if you can help us to determine how we can be better stewards over our skin. What are we seeing here?
Okay, so this is a condition called Kawasaki's disease. It is actually a viral disease and it's more common in children. And many of the children develop the rash when they're exposed to somebody that had the coronavirus. As you can see, the differences between dark and Caucasian skin is that on the Caucasian skin, you see how erythematous these skin lesions are. When you look at the darker skin or the Black skin, you see that you just see small bumps. Sometimes in the very beginning, our skin can be red, but it fades away very quickly. And sometimes we never get the redness or erythema at all.
Okay, what about this one?
So this is another condition. This is either cutaneous lupus or sarcoidosis of the skin. I believe this is cutaneous lupus. But if you look at the Caucasian skin, you see how erythematous the rash is on her eyelid. When you look at the brown skin, you do not see any erythema at all. Erythema does not always show up in pigmented skin.
What about this?
This is what's called the vasculitis, and we've seen this as a result of people who have corona disease and people who have heart disease. They're erythematous plaques. As you can see on the Caucasian skin, they're very red, they're very angry looking, but on the person with brown skin, it just looks like a dark mark.
It does. It really
And
does.
Dark marks are very concerning to people of color. That is one of the biggest complaints is hyperpigmentation or dark marks.
Yes, and we had a viewer question on that. I will definitely ask you it before the show is over. And because we are in the midst of this pandemic, we're all leaving our homes. We're putting on these masks, and some are coming home to find some type of breakouts on their face. Do you have any advice for them?
Well, breakouts seem to be very common, and probably one of the reasons is that we're wearing these masks all the time. We're sweating. We're not getting air. It is very important that you change your mask every day. Maybe even wash your face with an antibacterial soap sometime. There are over-the-counter things like benzoyl peroxide or salicylic acid that can help with the breakouts. And if those things don't help, then you maybe should schedule to see your local dermatologist.
Yes. Now, we can talk about it here, but actually, skincare reached page 6, TMZ, all over every media outlet, thanks to a rapper. Her name is Cardi B. She tweeted out a picture of her skin, and in this tweet, Cardi wanted to know what in the world was going on with her skin. And I'm going to take that question that she's asking and make it a little more general for us. what are some common reasons people who may have never experienced any acne before may now be dealing with it?
Well, we know that acne is associated with hormone changes. And when folks are stressed and when things are, your environment is chaotic, you could break out from that. We do feel like the hormones kind of regulate the breakouts and control the skin. I don't know what she is using on her skin. Some of the products that we use sometimes can induce acne on the skin. And even some foods now can contribute to acne as well. There was a time when it was believed that foods had no cause of acne, but now we know that eating unhealthy foods, lots of fatty foods, sugars, and things, and not having a balanced diet with an increased amounts of fruits and vegetables can contribute to acne breakouts as well.
So it really is true that what you put on the inside shows on the outside.
Yes, it does. And we also realize that people who drink lots or large amounts of cow's milk can have increased breakouts on the skin as well.
Oh, wow. Speak to rosacea and black skin. Is that hereditary? Is it curable? And what is that? Where does it come from?
So rosacea is an hereditary condition. It's very similar to acne, but most times people will have breakouts in a certain distribution, usually the middle of their face. And their face tends to have some redness or erythema. Even though we're brown, sometimes you can still notice that erythema. However, the pattern distribution of the middle of the face is very important. It is a hereditary condition. It is a treatable condition. The meds that we have do not cure it, but we can treat it and keep it under control. And you want to do that because there is a, a, a long-term consequence of that called rhinophyma, where people get this big irregular eruption around their nose. So you don't want that to happen. So you want to definitely control rosacea.
Oh, wow. Did not know that. Did not know that. So that breakout that you see going and coming, even though it goes and comes, it still needs to be treated by a dermatologist, someone like yourself, to provide some type of topical drug.
We use topical drugs and we also use oral antibiotics. There are quite a few new topical drugs that work very well, but with bad flares, we usually treat patients with oral antibiotics.
And so with rosacea, you mentioned that that one was hereditary. Is that common? Most skin diseases are hereditary, and some are curable, and some are any of them curable?
Yes, some of them are curable. There are quite a few that are curable. And some are hereditary and some are not.
Okay, okay. And here are some questions that we received from some of our viewers. They have black skin and wanted to know, do they actually need to wear sunscreen daily?
Yes, your risk of skin cancer is not nearly as great as Caucasian skin. But what the sun does, if your skin is not protected, it puts dark spots on your skin, it ages your skin, it gives you more fine lines and wrinkles, and some people do have allergic reactions to the sun. So it is always a good idea to protect your skin every day in the sun. And you all live in the beautiful city of Miami. So you want to protect your skin because the sun is very intense there.
It is, but we've grown up without it. Like my parents didn't put sunscreen on me, but now as an older woman, I use a moisturizer. The moisturizer actually has a sunscreen in it, but just like the viewers, we were just raised where we didn't put skin sunscreen on our skin. So now we just want to not only know better but do better. So that's
Do
the
better.
nature.
That's right. You know better. And you're going to look much younger than people who did not use sunscreen.
Okay, okay. And then as it relates to having black or brown skin, what about eczema and grass irritations?
Well, eczema is very common in all skin types. That's one of the most frequent things that I see in my office. Sometimes eczema is inherited. There are a large group of people that have family histories of asthma and allergies and eczema. They tend to go along. You may have one, you may have both, you may have all three, but it's very, very common. Sometimes eczema can be an allergic reaction. And when you talk about grass things, those people who have eczema as a result of exposure to grass have it as an allergy. It's an allergy, and it's something that they could see an allergist about that could also help them with medicines to control it. And we as dermatologists can give them things to control it as well.
Okay. And earlier you spoke about hyperpigmentation. Another viewer question was, is there any way to get rid of old hyperpigmentation spots?
Yes, we use a chemical or a cream with hydroquinone, which is a skin bleaching cream. You have over the counter products that contain them, but you also have prescription strengths. Some people are concerned about hydroquinone, that hydroquinone can cause cancer. Well, that is not true. The strengths that we use, it is not a cancer causing agent. However, it is available in over the counter products. If the over the counter products do not work for you, and one of the ones that I recommend is something that is called Ambi Fade Cream. It's an over the counter product that a lot of patients, I recommend it to them and they use it and it works well. However, if that doesn't work for you, your dermatologist can prescribe a prescription strength hydroquinone cream.
Now, was that Ambi that you just mentioned?
Ambi, it's called, yes, Ambi Fade Cream. Ambi has, been taken over by, I think, Neutrogena or one of the major companies, and they kind of revamped the whole Ambi line, but they do have a product called Ambi Fade Cream.
Oh, okay. Because I do remember in the 80s, Ambi was very big and it worked. And then it almost seemed as like the makeup of that chemical seemed to be in layman's term watered down. It wasn't as effective. I'm not sure if they changed the
Okay.
makeup. What it just seemed as if it wasn't, but I'll let our viewers know.
Well,
We'll go
I,
try it again.
I think a new company bought them, so I think it might be better than it used to be.
Oh, okay. Okay. Another viewer question: how much does altitude affect your skin?
High people with high altitudes tend to have drier skin. They tend to break out with rashes more, because of the altitude. You're not getting, I guess, as much oxygen to your skin, so your skin can be very itchy and dry. So if you are going to be exposed to high altitudes, you make sure you have nice or rich moisturizers that you could put on your skin.
Okay. And what about blackheads on our skin? How would you recommend getting rid of them?
Well, blackheads are just another sign of acne. They're one of the acne lesions that is very common in people who have acne. We do have medicines that will help to extract those blackheads. You could also go to an esthetician who could possibly extract them. I do not recommend people trying to remove them themselves because a lot of time they end up damaging their skin. So I usually suggest people with blackheads, they either come to see their dermatologist or a dermatologist, or maybe even try an esthetician because estheticians have treatments that can also help to remove blackheads. But
Okay.
if you don't do treatment, they can recur.
Okay. And as it relates to skincare for Black women who may have found their skin to be excessively dry and it's flaking, are there any type of over the counter exfoliant treatments that you would recommend?
There are things that have glycolic or lactic acid or salicylic acid. Those are very good exfoliants of the skin. Also, there are products that contain retinoids. One thing I say that retinoids and glycolic acid do not go together. So if you use a retinoid product, your skin has to get used to it. I usually recommend that you use very mild products. And Typically, it could take up to 2 to 3 months for your skin to really be used to using the retinol. So at that time, you can add additional things. But if you do it from the beginning, it's going to be very, very irritating. Retinoids themselves can be irritating to the skin.
Okay, I'm going to shift gears with these next two questions. Even though it's Women's History Month and it was really tailored to women, I did have some male viewers who sent in some questions, and they wanted to know about
Sure.
Black men and hair bumps.
Yeah, well, that is a condition called folliculitis. There's something known in Black men as pseudo folliculitis barbae, and it has to do with shaving of the hair and the hairs going beneath the skin. It's almost like an autoimmune condition, unfortunately, but it's your hair is growing out of the skin, but the skin sees it as something foreign. So as a result, inflammation develops and the bumps develop. One of the things that we notice that people who shave very closely tend to have more of pseudofolliculitis barbae. So we suggest that maybe you possibly use an electric razor and not try to shave so closely because that does increase your risk of breakouts.
And is there something to shaving with the hair or against the hair? Is which one is better?
Is shaving with the hair is better. And one other tip that I have received from gentlemen that I've seen that have very smooth skin, sometimes I will ask patients questions about how do you keep your skin so smooth? Quite a few of them recommended that after you shave, you get a firm brush. It could be an inexpensive brush, and you just brush the areas where you shaved. And that helps the hairs to stand up and helps them, hopefully, not to cause irritation to the skin. And some of
And
them
the
also say they use scrubs as well.
Okay. The last question really relates to that. They wanted to know, Black men wanted to know, what is a good daily skincare regimen for them?
Well, I think I always recommend washing every day. In the morning, of course, applying a moisturizer with sunscreen. Some of them are just sunscreens, but some moisturizer with sunscreen, or you could do it separately. And it should be a light moisturizer. At night, I always recommend that folks wash and then they do something to improve their skin. So something like an anti-aging, something that's targeted toward acne or breakouts, or if they have oily skin, do something that is going to improve skin because we rejuvenate our body at nighttime. So we also rejuvenate our skin, which is the largest organ of our body.
Yes. So please, before we leave, give the ladies who are looking some closing thoughts on what we need to do to stay looking fresh, alert, and the best that we can be.
Okay, well, I always recommend to folks the same advice that I gave to the men was to wash twice daily. In the morning, use a moisturizer and then a sunscreen. And that's very important for you all living in your sunny area. And at night, do something that's going to rejuvenate your skin, like a vitamin C, a retinol, or a glycolic acid, something that's going to help to rejuvenate your skin. Our skin is only as beautiful as we take care of it. So we want to feel beautiful and we want to look beautiful. And so you have to put in a little bit of effort to keep it that way.
Well, thank you so much. I know that I appreciate all of the thoughts and knowledge that you brought. The viewers do as well. And we welcome you to come back anytime right here on The Culture. Thank you again for joining us, Dr. Holmes.
Thank you for having me. And you all and have a great Sunday.
Yes, and to you viewers, please don't forget you can join us tonight at 6 p.m. for another edition of My Two Cents, and we'll see you next time.
The Culture is produced and owned by Hip Rock Star Media and cannot be reproduced or broadcast without written consent by Jessica Garrett Modkins. All rights reserved.